I'm a 23 years old college student suffering from social anxiety and acrophobia. I live alone in Athens and have a good relationship with my parents. My childhood was happy and there is no family history of psychological illness or substance abuse. When in high locations, I experience heart palpitations, flushing, fainting, and a loss of control. However, I do not have vertigo. In stressful situations, I also get chest pain and muscle strain. I also feel these symptoms when meeting new people. I have no sign of depression and haven't received any prior psychological or psychiatric treatment or medication. I was referred to a university counseling center for therapy. The center used two assessments, the state trait anxiety inventory and the social phobia and anxiety inventory, to evaluate my anxiety level and analyze my thoughts, physical symptoms, and avoidance behaviors. For 20 weeks, I had to complete the everyday self-monitoring skill. My therapist requested that I track any changes in my ideas, feelings, and behaviors. I learned to recognize and replace negative thought patterns with good ones. To handle my physical problems, I was also given relaxation techniques and training in breathing and muscle relaxation exercise. My therapist also included assertiveness training to help me identify and improve my passive behaviors in difficult interpersonal situations. My therapist introduced me to cognitive behavioral treatment for my social anxiety and acrophobia. They taught me about the role of automatic thoughts in our cognition and how to recognize them. I was also given a self-monitoring diary of anxiety as homework. During therapy, I shared stressful life events where my anxiety symptoms increased. I learned about the three phases of cognitive restructuring and was given the dysfunctional thought record as homework. The third session was all about breathing and muscle relaxation exercises. My therapist also helped me challenge my dysfunctional thoughts and learn adaptive response. I learned to recognize my negative automatic thoughts and emotions during specific situations. I also learned assertiveness skill to help me socialize more effectively. We explored what assertiveness meant to me and how to be more assertive in social circumstances. The therapy also focused on identifying and facing my anxiety-provoking situations, which were classified according to the degree of anxiety they were produced. I was gradually exposed to these circumstances until I felt confident enough to advance to the next level. I also talk about my experiences of coming challenging questions and using the skills and techniques I had learned to control my anxiety. My therapist also discussed relapse prevention and ways to avoid it. We also talk about how I could apply what I had learned daily. During the follow-up session, I discussed my progress and said that I was still seeing progress and wasn't having any negative symptoms I had previously when in high locations or meeting new people. I kept practicing the breathing and cognitive restructuring exercises.